Dr. Kelly McCann, thank you so much for taking the time and your patience with trying to reschedule. Then we ended up in the back in the same spot. So I'm glad it worked out. But I really appreciate your time and just sharing your passion and your expertise. You've got a great history, a great story. I love your approach to medicine. So let's just get underway. And really the first thing I want to ask you, like I do every medical doctor or clinician that is working more in the functional, integrative, more holistic space, what's your story? Because I would imagine there's a story that got you kind of traveling down this road of less allopathic and more holistic care. So I'd love to hear it.
Thank you. Yes, there's always a story. And my story is a little bit different than a lot of people who get into medicine and then get disenchanted. I always knew that I wanted to do what we called holistic medicine. In fact, I was contemplating going to acupuncture school first. And I remember my parents sitting me down and having a conversation with me and saying, well, you should really think about just going to medical school. And I said, okay, I'll apply. But if I don't get in, I'm going to acupuncture school. And gosh darn it, I got into 4 medical schools. So my fate was sealed. But it all turned out to be for the best because being a medical doctor has enabled me to not only understand allopathic medicine, but to be able to incorporate the wisdom that does come from allopathic medicine into everything that I do, and really understand illness at a deep, deep level and what is going on physiologically with the body, and then how to intervene, and then eventually how to think about things differently. But that was really where I started out. And I will say I fought against my conventional training most of the way. It was not necessarily comfortable, or I didn't have a great time. We'll just say that, because I knew that what I was learning was not what I wanted to be doing. And so when I finally finished, graduated medical school, graduated residency, and residency was far better in some ways, a little bit more open. But when I finally graduated, I was like, oh my gosh, thank goodness I can finally go learn what I've been wanting to learn this time. Yeah, I'm finally free. Exactly. Yeah. Yes.
Yeah, that's awesome. I understand where you're coming from, just from the perspective of, as I expanded my education and training into more integrative, alternative therapies, and just conceptually thinking a little bit differently. I found it very difficult as an acute care practitioner working with a big hospitalist group. I just had this struggle, this internal kind of moral, ethical struggle of, oh my gosh, I know this over here, and I think there's things that can really help you, but it's not part of our recipe here in the hospital. So I really can't talk to you about that kind of stuff. And so I get it. And then, of course, the answer was start my own practice and be able to, treat patients in that way. So you focus on quite a bit of different things. Hormones, obviously a big cornerstone. But one of the things that's really intriguing to me and interesting, just, looking at your website and talking to you a little bit and researching, what you do and your approach is this concept and this aspect of trauma and unhealed pain and unhealed emotional pain as a root cause of illness, or at least definitely a possibility of exacerbating illness. And I've explored this concept previously with other guests regarding just how powerful the brain is and what an impact the brain has on our physical health. So just talk to me a little bit about that, because this is something I don't run across very often, where a clinician, really, that's one of the foundational root causes it sounds like that you work with. So talk a little bit about that.
Sure, I'm happy to. In my rebellion against conventional medicine, one of the things that I did was I took a couple courses in energy healing. So I did some Reiki, I did some healing touch, which was actually, taught by nurses. But from that came this idea of kind of the energy body, right? And the chakra system and how things can get out of balance. And, and then I set that aside for a long time and really focused on my training. And as I went through doing integrative medicine and then functional medicine and then started seeing patients, I kept diving into deeper and deeper complexities of people. So now I see patients who have mast cell activation, mold exposure, chronic Lyme disease, and when they finally get to my door, generally they're very sick. And, from a functional medicine perspective, we talk about things like mold as a root cause, environmental chemicals as a root cause, these chronic infections as a root cause, and they are, but underlying all of those physical world reality biochemical exposures is that energetic susceptibility. And when people have experienced early life trauma, when they, and that can be trauma with a capital T, that can be trauma with a little t, right? Yeah, because absolutely. All of those things impact our beliefs about ourselves, how we talk to ourselves, whether or not we love ourselves, our capacity for our boundary systems. So being able to say, okay, this is my stuff, this is your stuff, I'm not responsible for everything. But for a lot of people who experience trauma, we have coping mechanisms, and those coping mechanisms work in the time frame which they developed, but as an adult, they may not work. So people who are people pleasers, people who give everything to other people. There's a variety of different patterns, and those patterns and those beliefs that go along with those patterns set us up for susceptibility for other environmental exposures like mold, Lyme, chronic environmental toxin exposures.
So from what I'm hearing you kind of, from what I'm understanding you're saying is we may have these exposures, which we all do. We're all exposed to environmental toxins. But our toxic burden, if you will, is exacerbated by unhealed pain, unhealed trauma. Is that kind of what your philosophy is?
Yes. I mean, think about it this way. If I energetically, emotionally, intellectually, in my psychology, in my psyche, I can't say, this is my stuff and this is somebody else's stuff. And I have this very fluid idea of what a boundary is in terms of how I need to take care of myself and my over responsibility of taking care of other people, for example. Or if I don't really like myself.
Yeah.
Right? If I don't like myself energetically, it would make sense that everything that I'm telling my immune system is, it's okay to be under attack.
Heal me.
Yeah, don't heal me. Don't heal me because I don't deserve it. And, I'm not saying that this is all our fault. Absolutely not. I am not saying that. I'm saying that these energetic patterns are setting ourselves up for certain conditions. And those experiences that we have are a possible mirror for us to turn inward and say, okay, this is a pattern that I want to heal inside of myself so that I don't have to continue experiencing it in the physical world reality, right?
It's so good, and it's such a missing piece, I think, of clinical care. And I even talk about this a lot in the world of weight loss. If you don't heal the emotional wounds You can go on every special diet and all the GLP-1s and everything all you want, but that's just going to keep recurring.
Right.
Because the root cause isn't just, what you're putting in your body physically, but also what's there mentally, emotionally. And it's such a big missing conversation. And, I've even seen data on people being able to manifest disease or healing based on their thought processes. What are your thoughts around that?
I mean, there are plenty of people who have spontaneous remissions from cancer, right? And those have been documented. There was an amazing book called Radical Remission, Kelly Turner, and her PhD was looking at patients who had these remissions, and she interviewed them to try and figure out, well, what was it that they were doing differently? And in each case, each person identified what was the thing or things that they were really not, being in alignment with themselves in. And for some people, it was like, clean up your diet. You clean up your diet and that's good, right? For a lot of people, it was getting rid of a toxic job, a toxic relationship, not, being creative or whatever. So there were messages that they got when cancer came knocking on their door, and they heard the message loud and clear, and they made changes. And I think, it's so much, in many ways, it's so much easier with cancer because it's like in your face, you've got this diagnosis, right?
Right.
With complex chronic illness, it's the slow decline into disability that there's no one point in time when you wake up, you don't have a slap in your face that says, hey, look at this, right?
It just becomes a slow, gradual way of your life, it becomes part of your identity, really. You don't even realize it.
Exactly. And even more difficult to extract oneself from, right?
Yeah.
Because if you identify yourself as, I have lupus, I have rheumatoid arthritis, I have Lyme disease, I have mast cell activation, I am this. It almost becomes I am this, right?
Correct.
As long as we see ourselves as being that, we can never be healthy.
100%. Or, being a victim of that and that becoming our identity. And I am I am a anorexic, I am a cancer survivor or whatever. I'm sure you have story after story, and I'd love to hear some stories. But I have a story of a young lady who, I'm telling you, this girl in her early 30s came to me for hormones. And I'm sure, and I want to talk a little bit about that because there's things that people come to us for that are just, the normal stuff. But she was so young, and she was seeing a cardiologist for this and a rheumatologist for that and an endocrinologist for the other thing. And she just had all of these specialists, and she was on so many medications. And I don't know, I just had the feeling one day about asking her about her family life and her relationships. And she started crying. And having the conversation about toxic relationships was such a pivotal turn for her. Mm-hmm. And, she was already seeing a therapist. She was already doing Reiki. She was doing everything. And I just made this gentle suggestion that she consider setting boundaries around this toxic relationship and maybe even getting away from it, at least until she healed. I'm telling you, the next time I saw her 6 months later, completely different human. She had gotten off like 4 of her medications. She wasn't seeing the cardiologist anymore. She had this light about her, this smile that I hadn't seen before. And I asked her, what have you done? What's happening? And she goes, I severed the toxic relationship. And it was just miraculous to me to see this shift in her. I'm sure you see this a lot. So I'd love to just hear your thoughts on that. I mean, there's story after story, but
so many stories. Before I dive into stories, I did want to share this idea, right? So we think of symptoms as bad, right? We think of symptoms as something that we want to get rid of. So what if we completely reframe our perception of symptoms? What if the symptoms are not a negative thing, but it's kind of like those drive assist cars, right? So there's sensors on the side that tell you, okay, you're going out of the line, get back in line, right? And what if symptoms are simply like our, boundary sensors or our bumper sensors that say, hey,
messages, right?
They're messages, right? So you're going out of the line. You're going out of the line. What the path is that we're driving on in this life is to be the fullest, most authentic version of ourselves in this lifetime and to live out our purpose, right? So when we are not doing that, the body gives us messages. Hey, you're off track, right? So what we do in Western medicine is we put a Band-Aid on that. We give you an antihypertensive. We give you an anti-anxiety medication. We give you an antidepressant, right? So we're just trying to mask the bumper signals that you're going off track. Right. How insane is that when you start to think about it?
Yeah, it's like you're just putting, mufflers on your ears where you can't hear those messages that are trying to save your life.
Right. And
fascinating.
And get you on the path of who you're supposed to be, right? I mean, I really feel that our lives here on this planet, whether you believe in life after death or whatever your religion is, it's like most people agree that there's something beyond the physical body, right? So there's the physical body, there's the soul, and there's the brain, and we can talk about Plato and Aristotle and Descartes and things like that, and all those guys who messed up our understanding of the true reality. But here we are on the planet, and our life's goal is, this is a school, and our life's goal is to live our purpose and to be who we are. Yeah, that's right. And when we're not doing that, that's a problem.
You feel it, you know it.
And you know it, and you know it. Right. Right. But we are misinterpreting the signs and the signals and thinking that they're bad and thinking that we need to medicate them and thinking that we need to escape them and thinking that we need to go back to who I was before. Right. So this is the other trap that people get into. I just want my life back. I hear that all the time. I just want my life back. No, you don't want your life back because your life before was not in alignment either. Exactly. Yeah. Exactly. So let's talk about some stories. I had a young woman come into me and she had been on a journey. She had been on a 15-year journey before she even found me. And by the time she got to me, she was completely disabled. She couldn't walk for more than a minute without having to sit down on a stool. So she had stools and chairs and places to rest all throughout her house. She couldn't stand in front of a microwave for more than a minute, heating up some food. She couldn't stand in the shower to take a shower. Some days she was so bad, she had to plan when somebody was going to be at her house to help her to the bathroom because she was so debilitated. And it was caused by overwhelming fatigue, dizziness, and a very, very high heart rate. So she would stand up and her heart rate would be 140. When your heart is beating at 140 beats per minute, you are not perfusing your brain. You're just not. And so she couldn't think, she couldn't function at all. And, she had saved up so much energy for the 2 weeks leading up to our appointment. Actually, she recalls that it took her a couple weeks to recover just finishing out my paperwork. And my paperwork was like, 50 pages, but still, it took her weeks to recover from filling out all the paperwork. And she gets to the office and she can't sit up. Halfway through the appointment, she has to lie down because she's, and I watched it happen too. She starts to get a little gray and she starts to get a little glaze over her eyes. I'm like, okay, what's
her heart rate so high? Her
heart rate's so high, and her brain is not perfusing. And she knew that she had this condition called POTS, postural orthostatic tachycardic syndrome, right? It was POTS, and she had that diagnosis. She went to Mayo Clinic. She even got a diagnosis of mast cell activation syndrome there, but nobody did anything about it.
Nobody knows what to do with it.
Nobody gave her any tools. She had a name.
Fight or flight, constantly. Layer that.
Oh yeah. So, and we weren't really talking about this mind, body, spirit connection, peace, life purpose. I'm like, trying to get her to feel a little bit better. So put her on appropriate medication for the POTS. That alone just changed her life. It dropped her heart rate into the 90s. Now she can actually stand upright and sit upright.
Nobody had done that with her at Mayo?
No.
It's pretty basic.
No, it's pretty basic. No, I mean, she was on nothing for mast cell. This was just the most horrible situation for this young woman who was really, really struggling. And so, put her on appropriate mast cell support, identified that there was mold in her house, identified that she had Lyme disease and a couple other chronic infections. We started working on that. And, she was a seeker. She was a go-getter. She had found me, because she was listening to podcasts and reading forums and, really looking for help. For years, she didn't know where to look, and eventually she found me. So we're making progress. Things are getting better. And we started having these conversations about, some of the things that we're talking about. And she got it. She knew what I was talking about. And there were probably a handful of instances where it's just like giving her a little nugget of an idea, and she would run with it. And at one point, she came in and her husband had just told her that he wanted a divorce. And this was a man that she had known since college. He had been by her side, been helping her this entire time through all of decade plus of helping her to the bathroom, of doing all the things for her. And here she is now getting better. She's functioning better. She's feeling better. She's having more good days. And she's kind of like, WTF, dude, I'm getting better. Exactly. We're finally getting our life back. You want a divorce?
There too.
Exactly. You're like, what's going on with him? So she's devastated. And, and she says to me, he was the only one who was consistent this entire time. And I said, no, that's actually not true. You were the only one. Yeah. You were the only one who was always there for you. And that subtle change in her perception just really helped shift. Now, granted, it was hard. It was a difficult, challenging thing to go through. She went through the divorce. She moved out. But at the same time, her progress was so amazing, right? This is a woman who couldn't stand upright for more than a couple of minutes. And she's moving out of her home with her husband into an apartment with her sister. She did everything. She worked for 14-hour days, a couple days in a row, like packing up her stuff, moving her stuff, and her family helped her, of course, but she was capable of doing that.
Right.
And this was, 2.5 years into it. So her life has been totally transformed. Not just in a physical world reality, but mentally, emotionally, spiritually, all of that. And now she's lost like 40 pounds and she looks great and she's so happy. It's so much.
It's such a key thing. And, when you see a lot of patients with hormone and thyroid and, other things like that, how are you integrating this type of care into, just your everyday, here's a perimenopausal, postmenopausal woman coming in with the usual symptoms. How does that work? Is it more opportunity when you have conversations and you see that there might be something deeper there? Or in your opinion, does everybody pretty much have some stuff they need to work on that's impacting? Because, and I tell women, I've seen this. I'll have two women on paper with the exact clinical profile of their stage of, let's just say, menopause. And one woman is miserable and, ready to commit homicide. She's just miserable. And then the next woman with the exact same lab parameters, the exact same everything else is just got such a great attitude and disposition. Right. So that has to kind of play into a little bit of what you're talking about, I'm guessing.
Absolutely. Absolutely. I mean, what are our perceptions of aging? What does it mean to be an older woman, right? What regrets do they have? Does the one woman regret that she didn't have children or that she didn't have as many children as she wanted? Or, does she have a terrible relationship with her older adults in her life? And there's so many potential things that can be impacting how we transition in our lives, how we experience everything in our lives, right?
Sure.
I had this other woman who had a history of thyroid cancer, and she was kind of a hot mess, right? She was fatigued. She felt terrible. Like her medications were fine, right? She was on thyroid replacement and she was postmenopausal and, but she felt terrible. She had no energy. She had a lot of pain. She had a lot of fatigue. And basically her life fell apart when she was diagnosed with thyroid cancer and had her thyroid resected. And I've had other patients who have had that too, and they're totally fine, right? So what's the difference between these two women? And that woman really had a hard time with speaking her truth, right? She was from a family that believed that confrontation was to be avoided at all cost, and that you really weren't supposed to speak your mind. And she, prior to the diagnosis, she was in a business relationship with another woman, and the other woman screwed her. Basically, left her, it's like stole all the clients, stole a bunch of money from her, left her in debt, with this business that was now failing. And she didn't say anything. Nothing. Didn't confront her.
What struck me as interesting is the thyroid is right here, where your voice is.
Yes.
It's fascinating.
It's not surprising that many, many women suffer from thyroid issues.
Right.
Why is that? We're not speaking our truth. We're not allowing what our truth is to connect our head and our hearts. Right? Because it's also, not only is it over the voice box, it's really the place between that connects our head and our hearts. So if we think something and we're not speaking it, or if we're speaking from our heart and not speaking from our head, we disconnect. So I think that there are multiple reasons why people will end up with issues in a certain body part.
Yeah.
There's plenty of metaphor around it, but I think that each individual has to really self-reflect, like, what is it for me that I have these particular issues? And you can start with metaphors, and you can start with the chakra system, and you can start with Louise Hay, and trying to, sort this stuff out, and then do your own self-inquiry.
Yeah. So just for, listeners, I think I love giving practical tips and tools and around things like this. And so for people that are just listening and wondering, okay, how can I start just even doing a self-inventory of things that I might need to be aware of or shift perspective on, because I have a certain chronic pain or a chronic something. And they're considering, okay, I've tried everything. I've gone everywhere. I'm on 500 different meds and nothing's working. Just what are some simple tools that you give to your patients so that you would just share? I know you're writing a book, so I can't wait.
Thank you.
Sure to be in there.
I think sometimes it starts with an inventory. Like, okay, what are the things that I'm really struggling with? And I did this for myself because I'm not perfect. I've got my stuff too, right? So
you can't be a human and have some stuff to deal with. Trauma. Exactly. We've all had varying degrees of trauma. If you're a breathing human being, you've got stuff.
Yeah. You've got trauma and you've got environmental exposure. So, right? Yeah. I wear glasses. I've worn glasses since I was 4 years old. When I was 4, I actually had a patch over my left eye because my left eye was weak. It didn't want to see. What's that about, right? Mm-hmm. There was something that I did not want to see in my environment. And what is that? I mean, I still have some exploration to do, but I'm sure it had a lot to do with my family dynamics and the fact that we were really good at sweeping things under the rug. My family is expert at that. And that's something that I struggle with. I need to work on that. So I think the first thing is really taking an inventory, and maybe even a look at things in a progression, right? So, what showed up first, what showed up second, and how things have progressed, because it might give you a clue as to, what's going on with your bumper alert system, that, you first showed up and these were the bumpers that became established. And even just reframing the symptoms as messages rather than something to medicate away can make a huge difference in the perspective. Like, can we actually embrace what we're experiencing and think about it differently rather than wanting to get rid of it? Like, and I know it's hard when you're experiencing pain, when you've got migraines, when they are debilitating. But sometimes those are the cracks that enable the insight to happen. And so if you find that you're, in bed with a migraine, well, let's reflect on it. What is that migraine there to teach you? Migraine, right? To tell you. Migraines are generally like anger that's being suppressed or repressed. Mm-hmm. And what might you be angry about? Mm-hmm. When did the migraines start? What was going on in your life at that time? How is it that you? Yeah.
Go ahead.
No. How is it that you didn't feel like you could express your anger? What were you taught about expression of anger?
Yeah, maybe it wasn't allowed, or family of origin issues are such a root for so many things. And I think about specifically patients that I've seen that have come in for hormone optimization, and they've got the typical fatigue and depression and, all the typical things. And then you optimize their hormones, you optimize their, any nutrient deficits that they may have. And I'm thinking about a specific patient that, I mean, we have journeyed everywhere, and that overall sense of depression and sadness and oppressive feelings still exist, and that's not normal, and so there in situations like that, I would imagine you do need to kind of take an exploration of, all right, where is this coming from? Maybe journaling, I would assume, and just kind of peeling it back. Do you see do you see a lot of that with patients that have just chronic ongoing fatigue, depressive type symptoms that you're able to get them to journey through root of that?
Absolutely. And
Big one.
I typically, because I am a medical doctor and people are coming to me with that perspective, it's often like, well, let's look at your supplements. Let's look at your nutrients. Maybe you need some 5-HTP. Maybe you need some, dopamine support. Let's look at that too. But yes, absolutely. And where there's openness in the patient, there's always an opportunity for a reframe, right? I think people get depressed when they're not living their life's purpose, when they haven't given themselves permission, right?
No doubt about it.
So maybe it's that. If people tend to have a lot of anxiety, they are projecting into the future, not really living in the present. And how can we help them reframe the way that they're experiencing things? Not to say that anxiety doesn't necessarily have a physical base and, reality. I'm not saying that. I'm saying, if we do all of those other things and we, optimize nutrition and we optimize sleep and, all those things, all the hormones, the thyroid, if people are having palpitations, all of those things, and those get optimized, and then that opens for the space that if it's still happening, maybe there's a deeper lesson here.
Yeah.
And I'm really working on trying to be very cognizant of the languaging that I'm using. We tend to pathologize things.
Yes.
And I really want to move away from that kind of languaging and look at it from a much more positive perspective. It's not like, oh my gosh, I have these things I have to deal with. It's like,
right.
No, these are beautiful opportunities for growth and transformation.
Well, and especially this concept of, oh, I have these things I have to deal with. What pill can you give me? What quick fix can you give me? And, often I tell patients, look, this has been something you just told me you've been dealing with this for 10 years, 15 years. You got to give yourself some patience, and it's not going to happen overnight. Is there any last nuggets that we haven't talked about that you really want to just make sure you get out there in the world, which is your gift, before we wrap it up?
Thank you, Dr. Terri. I think what I would encourage people to listen to hear is that there's always hope and there's always opportunity for growth and transformation. We are not meant to be static and we are not meant to suffer. And usually we need a partner who is going to help guide us. And so oftentimes that means finding the right healthcare team to be able to be your advocate, to be your cheerleader team, to really help you get where you want to be in your life. And not all providers are created equal. Yeah. And if somebody is gaslighting you or not believing you, please leave.
Yeah, find somebody else. That's right. Somebody else said that so many times.
Yeah.
And we're all very intuitive people. If we pay attention to that intuition, and if it doesn't feel right, it's probably not right. I just thank you again for what you're doing in the world. It's so important, and there's not enough of you out there. But I think that it's just so important that people understand these concepts and find somebody, like you said, to help walk these things out, especially if they've been suffering for a really long while. I appreciate taking the time.
Absolutely. Thank you so much for having me on your show. I appreciate it. And I hope that this was valuable for your listeners.